Have you gotten sick yet this year?
Achoo!
Well, buckle up. In today's video, I'm going to be going over the skin warning signs not to miss that you have a viral infection or that you have recently been sick with a viral infection. It's winter time. We're a lot more likely to be getting sick with colds, flus, diarrhea because we spend more time indoors in close proximity to one another. Quick PSA, wash your hands. Good hand hygiene is one of the most effective ways to prevent the spread of colds and flus to keep you from getting sick or getting other people sick. Viruses are notorious for causing what are referred to as viral exanthem. An exanthem is a fancy name for a rash that is typically widespread and often accompanied by just sort of symptoms of being unwell, like fever, headache, malaise, sore throat perhaps, swollen lymph nodes. Now, adults can get viral rashes, however, they're significantly more common in young children. One thing about viral exanthems is they are in your face. They really alarm people. What the heck is going on? I am breaking out all over. Oh my gosh. It's really kind of scary for a patient to have a viral rash. But the good news is viral rashes are all bark, no bite. They typically go away on their own, leaving no scarring behind, and they don't require any treatment. Now, they can be itchy and you might have a bit of a headache, feel unwell. So those symptoms can be treated, of course, with topical moisturizers, steroid creams that address the itch, and if necessary, a little bit of Tylenol for like the headache. But you really don't need any medical treatment. They will go away on their own. However, it's important to show these rashes to a healthcare provider because, like any rash, any skin problem, there are dupes. Other things that look like the rash that are not that rash, and so you need to make sure you know what you're dealing with. In no particular order, probably one of the more common viral exanthems that, again, more common in children, but young adults get this as well. It's called Petasis Rosia. Petasis Rosia literally translates to fine pink scale. It often happens after a viral illness, including maybe you had a virus pass through your body and you never actually really got sick, but it did this. The typical presentation starts out as a round, oval, pink spot, usually on the back, but can happen elsewhere on the body. The spot is anywhere from 2 to 10 centimeters in diameter. A lot of times patients don't even notice this because, again, sometimes it's on the back. However, over the following roughly 10 days, you start getting an eruption of smaller spots that look very similar in a more widespread and symmetric distribution, usually on the torso, the back, the legs, the arms. Classically, the typical presentation, however, spares the face, the palms, the hands, the soles, and the feet. This rash usually lasts anywhere from 6 to 8 weeks. It kind of evolves through stages, and it often ends up getting real flaky and scaly, sloughing off, and then it goes away. Sometimes if you look in the mouth, you might have sores in your mouth, what are called petechiae, look like little blood blisters, and you might even have a geographic tongue. As a side note, I have a whole video on geographic tongue that is quite enthralling, so make sure you check that out after you watch this video, of course. So that's the quote-unquote typical presentation. However, there are atypical variants. It can present in other ways. There is an inverse Petasis Rosia in which the rash erupts in atypical locations, the face, the hands, and the feet. Petasis Rosia in Black patients is a lot more likely to take on these atypical presentations. Black patients are a lot more likely to have more widespread eruption of their rash, and they are more likely to have their rash accompanied by lymph node swelling. Black children in particular are more likely to have Petasis Rosia of a particular atypical presentation where rather than these round rashes on the body, they have these almost like little bumps, small bumps, often on the face, the scalp, and for whatever reason in Black children, the course, the duration of the rash sometimes is a lot shorter, 2 weeks. Generally speaking, Petasis Rosia lasts on average anywhere from 6 to 8 weeks, and then it goes away. Sometimes, however, it lasts much longer, 6, 8 months even. Once it starts lasting that long, it's called Petasis Rosia perstans, meaning it's kind of persistent. But eventually it does go away. While it goes away and doesn't leave any scarring behind, in Black patients, it often leaves behind post-inflammatory hyperpigmentation, dark spots, or hypopigmentation, light spots. And this takes a long time to fade away, but eventually your normal skin color will return, it will go away. Now, the rash of Petasis Rosia, while it is associated oftentimes with having a viral illness, the rash is not contagious. So if you have the rash, you're not going to spread it to anyone else. And for the most part, you'll never get it again. About 2% 10% of people, however, do experience a recurrence. If you have Petasis Rosia, I suggest sticking to very gentle skincare. Don't go testing out any body scrubs on this rash because the skin is trying to recover, especially if you have a deeper skin tone. Using scrubs, harsh cleansers, etc. on the skin can create a lot of irritation that makes that hyperpigmentation even more stubborn and take longer to fade. Just stick to mild cleansers and fragrance-free body creams, lotions, moisturizers, which can help if you are experiencing any itch associated with the rash. Petasis Rosia can look like some other types of rashes, including syphilis. So don't be surprised if your doctor, while very confident that you have Petasis Rosia, goes ahead out of an abundance of caution and checks to make sure you don't have syphilis. Remember, syphilis is not uncommon these days. As a side note, I have a whole scintillating video all about the warning signs of syphilis, not to miss, so definitely check that out. And also, it can look like ringworm. So they may scrape some flakes off, look at them under the microscope to make sure you don't have a ringworm. The next viral rash I want to talk about is something called Goncrosy. If you have young school-age children, this is something that you might want to know about. Doesn't really happen in adults, although I have seen a case or two of it in an adult. More common in children 6 months of age to 12 years of age. This can be seen after RSV, respiratory syncytial virus, which we've been having a lot of cases of that lately. Not fun. It also can be seen with Epstein-Barr virus infection, Coxsackie, echovirus, and hepatitis B. While this often happens as a viral rash to these viruses or other viruses, it also can happen after a bacterial infection, like a strep infection. Over the course of roughly 3 to 4 days, your child will develop these little flat and raised spots, usually pinkish in color, and sometimes they're like these little blisters associated with it. Those are called vesicles. First on the thighs and buttocks, then the upper arms, and finally the face. It lasts at least 10 days, but usually anywhere in the ballpark of 2 to 8 weeks. Like Petasis Rosia, it's very rare for the child to ever get this again, although there's an exception to every rule, of course. In contrast to Petasis Rosia, which gets very scaly, Goncrosy, there's typically no scale, so no flaky stuff. Also, in contrast to Petasis Rosia, with Goncrosy, it almost never involves like your torso or your back. Sometimes it can exclusively involve the face. These cases appear to almost always be associated with Epstein-Barr virus infection. Children who have atopic dermatitis are more likely to get Goncrosy compared to other children. All right, that's Goncrosy. Again, goes away, doesn't come back. Your child is not harmed by it. There's no scarring. If your child has a deeper skin tone, there may be some post-inflammatory pigmentary changes, but eventually their skin goes back to their normal color. And the rash of Goncrosy is not contagious. Number 3 is Laterothoracic exanthem. This is a rash that happens on one side of the body. Girls are more likely to get this than boys. It can happen as a result of exposure to viruses that cause colds, flus, upper respiratory tract infections, viral diarrhea. This starts out under the armpit in the groin area as like these little red raised bumps, sometimes some flat spots mixed in there as well. And it gradually extends outward down the side of the torso. It can extend into the groin. It may spread to the face, the genitalia, and the hands, but it stays on one side of the body. With time, the little tiny bumps, they kind of come together into these larger areas. The older spots sort of turn gray in the center, and it kind of looks like this more inflamed dermatitis before going away. A lot of times a child might have a little bit of a fever, swollen lymph nodes, and they might have diarrhea if it's like a virus associated with a stomach flu. Again, not dangerous, not contagious, and once it goes away, it's gone, and for the most part, they don't get it again. But as you can imagine, this scares parents. They're like, oh my gosh, what's going on? And as a side note, if you take your child into the urgent care, the ER, a lot of times they know what's going on, but like in the case of Petasis Rosia, sometimes, you know, the atypical presentations can really fool non-dermatologists. I mean, it's not something, at least that I was taught in medical school. I didn't learn about it until my dermatology residency. Speaking of going to the ER or urgent care, I want to talk about another situation. Let me know in the comments, are you allergic to penicillin because you were told you're allergic to penicillin based on an experience you had as a child that you don't remember? If so, you're going to want to hear what I have to say. So it is not uncommon for people to experience a viral illness related to Epstein-Barr. Often consists of having fever, being incredibly fatigued, having swollen lymph nodes. Once you're exposed to Epstein-Barr virus, it incubates in your body for about 4 to 6 weeks. Then you experience what's called a prodrome for about 1 to 2 weeks. weeks in which you just don't really feel particularly well. A lot of people, you know, they don't really feel so good. They have a really bad sore throat. Maybe they go to the urgent care, and maybe it's not clear if they have a viral infection or a bacterial infection, a bacterial sore throat, strep throat. So what happens is they're given a penicillin, like ampicillin. And a lot of times what will happen is that ampicillin in the background of a viral infection, because remember, penicillin is an antibiotic. It's meant to treat bacterial infections. The urgent care thinks that perhaps you have a bacterial infection, so they give it to you, but you really have a viral infection. What happens is your immune system, body, whatever, is like Epstein-Barr virus plus penicillin, let's make a rash. And you get diagnosed as being allergic to penicillin. It's not really a true allergy though. And I'm telling you guys that because if you're someone who was told as a child that you had an allergic reaction to penicillin, but you don't remember it, you don't really know the details of it, it's possible that this is what actually happened and that you don't actually have an allergy to penicillin. How will you ever know? Isn't it dangerous if you're allergic to penicillin to take it? It's kind of a scary thing to tease out. Allergists can help you figure out if you truly are allergic to penicillin or if you had this reaction based on having Epstein-Barr virus, which isn't an actual true allergy. It's kind of like a, I don't know, rerouting of the immune system is a way to describe it that causes this rash. The rash is typically widespread and brownish in color, raised spots, and it goes away. So in summary, these rashes, they all go away without any treatment. They're a sign that most likely a virus has passed through your body. Viruses do weird things, and if you were ever told that you had a rash after getting penicillin as a child, it could have been Epstein-Barr virus that you actually had, not a true penicillin allergy. All right, guys, so that's a wrap up with regards to signs of a viral infection. Now, let's get one thing straight here. By no means is this a comprehensive video of all viral rashes. Rashes related to a viral infection, I should say. You know, we've got chickenpox, we've got shingles, we have herpes virus infections, we've got herpes cold sores. I already have videos on a lot of these things, but today's video is specifically on the non-specific viral rashes that can pop up if you get like a cold, a flu, a stomach flu, as is common this time of year. I really hope this video was helpful to you guys. I hope you are staying healthy, not getting sick, and that this is just pure entertainment for you. Knowledge is power. I hope if you have young children at home that they're not sick. Hopefully this saves you a bit of stress in the future. All right, guys, if you enjoyed this video, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.